Do any of you have any questions before we start? Any at all? Come on, we need one.
I do kind of have one. It doesn't have to do with the class today, is that okay?
Yeah?
The vitamin D that you carry, is that a good one to take for the winter to help keep from getting
I
sick?
think it's the best,
Okay,
yeah,
good, then I need some of that too.
okay. It's very, very effective. Anybody else want this?
Yes, I do, please.
Do you have Redmond salt?
Yes. I have a small bottle
Okay.
for 5.5 25-pound bag for 80,
Okay.
whichever you want. I get a discount.
I'll get some after.
So that was easy.
Yeah.
Okay, so today we're going to talk about whole body vibration. And for those of you who have them, my goal is to help you to be able to understand the value of them, more specifically to help you with individual personal health problems. Keeping in mind that the body is designed so that the nerves come out and go to different organ tissue as well as muscle tissue. So today when I'm talking about an area of the spine to do therapy on the whole body vibration, if you think you might have a weakness or you know you have a weakness functionally in that region of your body, pay particular attention to how to do therapy for that area. Okay? As a chiropractor, many times patients are treated off the chart to the nerves from the organ, and that's all that they treat. The concept that we use here is to treat the whole spine, top to bottom, and to treat all of the functions of all the organs, and do it at home, do it on a regular basis, so you get more value. If you have no problems, this is one of the best things you can possibly use to prevent problems from developing. If you have problems, even if they're very severe problems in your body anywhere, the whole body vibration provides for you the kind of therapy that will upgrade the function of whatever's going on right now in the body. So it can be used as a corrective device as well as a preventive device. Now, a little bit of history. Whole body vibration was first developed by direction from the Russian space people, because the Russians would go into space, they come back several months later, they would have lost bone density and muscle strength and volume. As you know from prior discussions about bones, bones make stem cells. Stem cells develop into whatever kind of cell is needed in your body at the time. When you have osteoporosis, stem cells are not made as healthy or in the same number as when your bones are strong. The whole body vibration builds healthy bones if you use it properly, and I'll teach you how to use it for that purpose, provided you have adequate nourishment, which means protein and some other things. So it helps you in many, many ways. Now, a lot of people who use the T-zone don't get sore, and that's the goal. The goal is to not get sore. the goal is to use the T-zone short time, very frequently. So when we talk about repetitive microtherapy, that's exactly what this does. It trains, it helps your body train new growth of new nerve flow, blood flow, bone, tendons, ligaments. It helps the lymphatic system. It helps nearly all tissue in the body. As opposed to if you go to a gym or you do workouts, you isolate muscle groups and you only get that group done. When you do the whole body vibration, you're doing the whole body all the time. So you get way more value on it. When you first start to use the whole body vibration, you have your feet close together, 5 inches at the heels, 6 inches at the toes, to create micro motion until your body gets used to the motion. And then you can widen your feet. When you get out to the edge, you're tipping more than an inch. And that, so the intensity of the therapy, and the value of the therapy is enhanced with width. Now, speed we're going to talk about. I always recommend slow speed on the number from 1 to 10, because at the slow speed, whenever it tips, a message leaves your feet, goes all the way to your head and back down to your feet to keep you from tipping over. The T-zone will tip, and I'll pass this chart around. You can look at this chart. It tells you exactly how many times it tips per second. It's called Hertz, or Hertz is a cycle. So when you put it on the speed of 1, for example, it moves 3.4 times per second. Now that's pretty fast, but the body's faster, so the message can go up to the brain and back down before it tips the other way. So it's traveling about 4 or 5 times that fast. When you have the speed higher, like at top speed, 99, it's going 15.5 times per second. So it's very fast. The higher speeds help relax the
I've got
body.
a message, I have to leave, I'm sorry.
That's fine, thanks for coming.
Thanks.
Now, one of the great advantages that we have who have the T-zone is we can do it in the comfort of our home. We can do all we need in about 12 minutes a day. I recommend that you, when you start using it, that you divide the 12 minutes into 2 or 3 time slots. So you do either 3 minutes or 4 minutes a few times a day. Can you use it more than that? Yes. You can use it the full 12 minutes at one time, and you can do that a couple of times if you really want to or need to. But it's better to do short gaps periodically than long time one time. Okay, and now back to what I started to tell you about the Russians. The Russians devise whole body vibration, sent a small unit into space. They use it to stimulate blood flow to the bones, so the bones did not degenerate. They did not get osteoporosis. They also had muscle motion, even though it's minimal muscle motion, help maintain muscle strength and stamina both. So when they came back healthy. Without it, they came back sick, and it took them a long time to get well. Now, once the word got out, the Germans learned about it. The Germans decided to build a bigger whole body vibration machine, like a big platform, and they put their weightlifters on to lift weights. So for about 12 years, the Germans kind of took the world over with muscle strength due to the whole body vibration benefit to their athletes.
Okay, I was thinking, could you do your things like, you know, while you're vibrating.
Now, that's a perfect question. The question was, can you do the occipital release while you're on the T-zone? The answer is yes. Can you do the microcranial mobilization? Yes. Can you do this one for the sinus? Yes. You can do all that while you're moving.
Kind of hard to do the sacral slide.
Technically, if you have your feet out wide, you are getting a lot of value of the sacral slide. It's different when you lay down. See, I recommend you do both.
Oh.
Thank you for asking that question. So when word got out, then the medical people and the colleges and the professional athletes started to do experiment. And so now, right now, whole body vibration is one of the top topics which research and use, and it's becoming prevalent all around the world because of the value, the high value, and they're practical. I went to a medical seminar in Denver a few years ago. They had a couple of machines that they were marketing to medical doctors, physiatrists specifically, and they sold for $16,000. And the good news was for the medical doctors, they could put them in their office and have you go in and use it for 12 minutes. They could bill $150 for neuromuscular re-education. And so they could, very financially profitable for them. But for the customer, you and I, 3 times a week, that's okay, but more often is better, always. Okay, do any of you have any questions about what I said to you so far? I'm going to pass out to you a test. I told you some of the things on here. We're going to go through the test very quickly. I'm going to add some information to you to save time as we go through this. So take one and pass it around.
But not that there's only one. His life is like a candle, and then those two are not part of it, right?
Take the top one. Now, one of the big advantages of the whole body vibration is when you stand on it, it helps your body become neutral. Neutral means balance. With the center of the head directly over the center of the pelvis. I'll demonstrate that to you as we go through the class. Now, very quickly, the test. Number 1, true. The Russians had it first, then the number 2 is also true. The Germans got it second. Number 3 is true. They've proven that you only need 10 minutes in the home on the T-zone to have the same value as 1 hour at the gym. Why? Because you're doing all the muscles, not just a few. Number 4, one reason the whole body vibration is so effective is that it activates all the muscles, and underline the next words, it reestablishes nerve pathways. That's critical, because if you create the demand, structurally, the nerves will grow to create nerve pathways to hold the body into balance and alignment. Now, think of a 1-year-old child learning how to walk. The biggest challenge for a child learning how to walk is to balance their head. Their head's heavy, and they're just trying to stay underneath it. And when you turn 65, you're back in that same category. Trying to keep your head balanced, because if your head goes forward, your head mechanically becomes heavier. They tested and they say that for every 1 inch that the head goes forward, it gains 10 pounds. So if your head is 4 inches forward, you have 40 pounds extra that you're carrying around. That does tremendous damage, not only to the neck, but to the whole spine, especially the low back. And most people have surgery on the spine. It's in the low back, L4 and L5. And a lot of it has to do with the head being forward chronically. Number 5, strength and endurance are more important than motion, balance, and alignment.
False.
False. Thank you. Here's why. Without good motion, without good balance, without alignment, the body will not function at its strongest potential. The body has built-in safety mechanisms, like an engine that has a governor that will only allow it to go so fast. In fact, I saw a fellow this morning who's been pulling a lot of weeds, and he said, my hip dropped out from under me. And why? Did it go out of joint? And I said, no. When I checked him, he had done enough work. His hip and low back got so tired that his body said, no more. So I encouraged him to have more respect for him than the project, not be project oriented to the point that he was self-destructing.
So with that, you said that translates to you'll be stronger and have better endurance if you're balanced and in alignment, right?
Yes.
So do you have any examples of?
I do. In fact, I had a German weightlifter from the Olympic Training Center in Colorado Springs came to see me on a Friday with bad low back pain, and I checked him. He was imbalanced. I balanced his pelvis, put a little wedge under his shoe to help hold him temporarily while they rehabilitated. He came back Monday, walked in the door, came over, grabbed a hold of me, like this, a big guy. He grabbed a hold of me, gave me a squeeze. Dr. Smith, I love you. I thought he was gonna kill me but I said, why? Sunday, he lifted 450 pounds. He lifted 45 pounds more Sunday than he had ever lifted in his entire career, just because we balanced him. Now, that was before I didn't have a T-zone at that time, but that would have done the same thing for him to train him to be balanced. When you stand on the T-zone, you automatically, your body hunts for that balance point. Number 6 is true, and the Russians proved that you can reverse osteoporosis and arthritis. Arthritis can correct on its own within the body if you do a couple things. Number 1, good nutrition. Number 2, proper motion, balance, and alignment. I give you another example. A very bad example. A patient had severe arthritis. Her name was Helen. Helen came to see me with severe hip pain. She could hardly walk and the pain was intense. I took an x-ray of her standing. Her femur head had infection in it. Her femur head, instead of being a round ball, was kind of flat on top and eroded. The socket, which it fit into, was also infected. There was no cushion, the bursa was gone, and the joint had deteriorated. My fear was that she would move wrong and suddenly allow the femur head to slip out and slide up, and that would have been very, very painful. So I said to Helen, you need to go now and get a new hip. You need a new ball, you need a new socket, you need a new ball, they need to stabilize that. And she said, no, I'm not going. I've had friends that have had hip surgery, and I'm not going to have hip surgery. I said, Helen, you have a very bad hip. It's very likely to slip out. And I tried to get her to understand how bad it could be. And she said, no, I'm telling you, I'm not going to go. And I said, you're very high risk. I'm not going to go. What can you do? So I took off my doctor hat, put on my farmer hat. I thought, okay, farmer boy, what would I do? What should I do? So I asked her, is your husband handy? She said, yes. I said, okay, we're gonna get creative. Go buy a lace-up tennis shoe that you can wear in bed at night. Have your husband drill a hole in the bottom of the shoe, put a little eye hook on it, and we're gonna have him hook that up to a rope that goes over the bottom of your bed on a little pulley. We're gonna take an end of a bag, so we can put water in it and change the weight in the bag. We're gonna pull on your leg every night when you sleep. And if you roll over, it doesn't matter because the leg will move, the weight will move. We're gonna gently add water and gently, gradually add more pull and see if that will help pull that space open so that your body can maybe do something. That's the best I can do. So she started doing that. She gradually got better and better and better. Less pain, less pain, less pain. Walked better. Every night, put a shoe on, got in bed, did that. About 1 year later, I said to Helen, I want to take a new picture to see what's going on in there. We took a picture of her hip. I was totally amazed at what I saw. The femur instead of being flat and eroded, the inflammation was gone. It had developed some cartilage cushion and more rounded, and the joint, the socket, where it was flat, and in fact it had grown an extension of over an inch, made it wider. So it grew over, didn't pull it back in, it just grew over. And the pain was way down. The pain was about a 3 or 4. And so we did it. She stopped wearing the shoe at night and she got better and better. Now about a year later, Helen came back to the office like this, holding her arm. I said, what happened? I think I broke my arm. We took an x-ray of her arm, broke both bones right there. They said, Helen, you need to go this time. For sure. Because if you slip and fall, that bone could come right through. You could cut an artery, you could cut a nerve. You really need to go. She said, no. I know my body can fix it with your help. And I said, okay, we have to protect it. Well, we protected it. Unfortunately, she did her rehab, repetitive microtherapy with a hand. We kept it protected. She never had any nerve damage or blood flow damage. When it was all said and done, what happened?
So I think of it as Afghan Day. She came into the office and said, you get an Afghan, you get an Afghan, you get an Afghan. And they were all Afghans that she had crocheted as part of her daily therapy to heal her arm.
I want to meet this lady.
Yeah, it was amazing. She had good motion and everything, and I mean, more
It was great.
Afghans than she needed. So
The body can do great things. Even when the doctor says you have bone on bone, you have no choice, we have to replace the joint. I think of Helen. I think of other people who have been treated and had the knees repaired, the shoulders repaired, the spine repairs.
but it took time, and they had to put forth the daily effort to do their part.
If they don't do it, they don't get it.
Yeah.
And when the doctor says, there's nothing we can do, that's totally honest. As a surgeon, as a medical doctor, they can cut or give a pill. They can't fix it. And I have to say the same thing. I can't do it. You have to do it. But you have to do the things you need to do to get it done.
I think it takes a special personality to do that, because a lot of people would do it for maybe a week and quit.
That's
And
true.
If it takes a year or whatever time frame it was, then you have to be very faithful about doing that.
Thank you. That's exactly right. Number 7. True. You don't need weights necessarily. You can benefit more with weights to gain strength, but you can get it on the machine. Aerobic exercise can be done. True. That's number 8. That's true. Whenever you do exercise for the first 3 minutes, regardless of what you do, it's anaerobic. That means you're burning the glucose, the sugars in the blood. Then it goes to aerobic. So the longer you're on it, the more aerobic you do. And if you want to add more value, then you add motion. You do active things rather than just stand and let the machine do the work. And I'll give you some examples in a few minutes. The maximum time should be 10 to 12 minutes. All the machines automatically shut off because that's an ideal time. If you do too much time, you will exceed tissue tolerance and do damage. Due to the intensity of the value, number 10, slow speed is better to start with. That's true. And the reason the slow speed is better because you have time to train the nerve. That's what we're training. We're training neuromuscular reeducation. It's in that order. We train nerves first, and then muscles, and then joints. And finally, tendons and ligaments. Keep in mind, there are over 206 bones in the body, and they're held together by more than 800 ligaments. And every joint, every area of your body where one bone connects to another bone, there's a special design of the joint junction. They all fit, even in the head. The design of the head, the shoulder, the hip, the knee, the ribs, the feet, the neck, all joints are designed to fit smooth and comfortable and are held there by ligaments. When you do the T-zone therapy, you're strengthening the ligaments and the tendons and the muscles and the nerves and the blood flow, all of it, all the tissue gets help. Number 11, true, the higher speed gives you massage-like benefits, which enhances relaxation, will help you sleep. Number 12, many
So,
people,
excuse me, would it be good then to do that for a couple minutes before you go to bed? On high
Yes.
speed?
yes, exactly.
And high speed would be what, if you put down at 12?
High
Above
speed,
30.
Huh?
Above 30 is
high speed is about 20. But I'm going to show you what I do, and you can take that for what it's worth. Okay, that's the end of the test. Now, I'm going to spend some time and go over special instructions on how to specifically do different parts of the body. We're going to start at the top. We're going to go down. I'm going to show you how you can specialize and localize the benefit to your body. I'll try to demonstrate most of these. Now, to start with, on the sheet, it will tell you the slow speed is 1 to 10. That enhances motion, balance, and alignment. That's the most important thing you can do. If you gave one of these machines to a friend or relative and they knew nothing about it, they got on it and just stood in a neutral balanced posture, it would benefit them. And the longer they have it, the more they use it, the more the benefit. So it will benefit you more 6 months from now than it does today. A year from now, it will be more beneficial. It becomes progressively beneficial. It's like investing money in a bank account, leaving it there. 11 to 20, that's when you want to build strength. And I'll show you something to help you build strength. That's the speed we're talking about. And fast massage. Now, I recommend that you change positions about every 15 to 20 seconds. That's important to you. You do something different. And keep in mind, anytime you make any change in anything, you've changed everything. You didn't just change that one thing. For example, if I turn my head right, my body reacts all the way down to that posture. If I turn my head left, it's a new pattern. If I put my arm out, it's a new pattern. If I bend my knees, it's a new pattern. One of the things that I stress for you to do to have higher value, and you can circle, combine frequently. That's on the top line. Combine different things to do. Now, Katie, I would ask you to be a reader, so I don't have to keep looking down. I'm gonna demonstrate most of what was on here. But keep in mind, I'm not going to stay in the positions for the full 20 seconds just to save time, okay? But that's what you do, you change. So we turn it on. When it turns on, it goes to the speed of 1. That's where they start. This is the clock. Every 30 seconds, it will automatically, the light will go out. It will go down to 0 and shut off. I'm going to try to do the whole thing in 12 minutes. Okay, so first of all, we're going to do the neck rotation. Most of the rotation in the neck occurs in the top part of the neck. So we just turn. How far? Stop at the edge of pain, meaning about pain level 3 or 4 on a 10 scale. Then go the other way. That's rotation. Now, I'm going to pass around a couple of necks. We're going to look at the neck bones. We're going to talk about 2 things. Number 1, the joint. The joints in the back are shaped like this. The discs in the front are shaped differently. To do joint therapy and disc therapy at the same time, I'm going to pivot my head slightly and lean the neck forward. That opens the joints and compresses the disc. Then I'm going to come back up, pivot the head up, lean the neck back. Now the joints slide down and the disc open up. With that motion that I just showed you, you can rehabilitate the discs in the neck. You can rehabilitate the joints in the neck. You can dissolve spurs in the neck that are pinching on the cord and the nerve roots. That's a very, very effective therapy to do. Simple. What's next? Shoulder?
Shoulder girdle, open and close like a door, both active and isometric.
Okay, so the shoulder girdle is this. The scapula, the clavicle, the shoulder girdle fits on top of the rib cage. And it's designed to slide and glide around and back. That's a major problem for a lot of people. Major problem. So This is closed. Slid it forward. This is open. I can do both arms, close, open. I can turn my hands, open. I can do the what's called the Y, where I slide both scapula back, W, slide them back, L, and then to T. And I can turn my body and slide, turn my arms, not my chest, my arms, to help improve and enhance shoulder girdle motion.
Torso, rib cage, deep breath, breathe deep, rotate, breathe in and out.
Okay, again, the rib cage looks like this. It's designed to open and close. It goes deeper and wider when you breathe properly. If you breathe properly, about 70% of the toxins that leave the body will leave through the lungs. Most people have problems with the chest motion. If we measure the chest expansion and contraction, breath out, breath in, we should get more than 2 inches. Most people can't do that because their spine is torqued. Now, you notice that a lot of the nerves that come out and go to the lungs, the heart, the stomach, the liver, the small intestine are all affected by that restriction and misalignment. So what do? Couple things. You can stand, take a deep breath. You can do it with your arms down. I like to combine, bring my arms up, take a deep breath, turn, hold, and then need to breathe, come back, do the same thing on the other side, turn, hold. Now we can do it reversed. We can turn, then breathe. It's different. Turn, breathe. We can also belly breathe. We can, now we're going to turn down here. Turn this, not this. Belly breathe. That helps with constipation, kidneys, incontinence, flatten the belly. That helps a lot of other things too.
E is low back, primarily flex, extend minor posterior, and backward lean.
Okay, the low back curve should be forward by design. It's designed like this. That's a normal low back. The vertebra taller in the front. That creates the curve. The joints in the low back are designed to go this way. That means you're going to bend forward and back. They're not designed down here to turn. Like if you're vacuuming or you're running trying to start a lawnmower, that's not for the low back. That's for up here in the ribs. These joints up here go this way so they can turn easily. These go forward and back. So to strengthen the low back, we just do this. We go down, make the low back curve greater. We stand up and lean back.
So when you say making the low back curve greater, you're pushing your bottom back as far as you can.
I'm lifting my
Lifting it
bottom up.
Lifting it up.
Lift my bottom, pubis down. Now, I'm also going to combine and do some knee therapy and foot therapy at the same time, okay?
Would it be the best to have your feet apart on that, or when you're just starting out with all those different movements, is it better to have your feet closer?
When you start out, heels 5 inches, toes 6. when you've done it for a while and you go wider, you have more intensity. Again, if you go too wide or too fast, too soon, you will exceed tissue tolerance and get sore. We don't want you to get sore. You don't need to get sore. Okay?
Ready? F, pelvis, standing and sitting, pubis down, rump up, turn 45 degrees, favor sides. You kind of did that.
Yep. And then we go to the hip. So the hip joint, the frame of the ball. If we do hula hoop motion, slowly, transferring the weight from one side to the other side. We go both directions. We're doing the hip. We're doing the sacrum. We're doing the knees. We're helping the ankles. We're helping the feet. So we've automatically combined therapy.
And any individual one of these things you should do about 20 seconds?
Yes.
Okay.
Now, if you do the math, it moves 3.4 times a second. In 20 seconds, it moves how many times? More than 65. So you move 65 times. That's a lot. If you go to the physical therapist, they're not gonna move you 65 times. They may do 10 or a couple of sets of 10 or 20 at the most. You get more value with less trauma. Now the knees. I'll tell you another true story about the knees. I had a lady came back and said, "I made my knees sore." I said, "Did you do what I told you?" She said, "Yes, exactly." I didn't believe her. I said, "Show me." She got on the machine. I'm not kidding you. She got on the machine like that. And I thought, "Oh, don't do that. You're tearing up your knee." Now, that brings up the question, if you've had a knee replacement or a hip replacement or a spinal fusion, can you safely use the T-zone? My answer is always, if you can walk, if you get in and out of the car, you can walk, you can go up and down stairs, you can roll over, you can use the T-zone. But you have to be smart, you can't be stupid. So you start out, sometimes they even have them start out with their feet closer than 5 inches. But they can do everything I've shown you and told you on the T-zone. They can't go out here and go high speed. That's not safe, okay? But they can do all the other things. If they have too much done, then we have to sit down. Now, I'm going to show you some things of sitting down. Just back up to it. Lie down. Slide all the way back. Get a hold up here, leg straight, pubis down, chest up, head back. Now I'm in a neutral posture, and the pelvis is going like this. 20 seconds, I have a lot of therapy in my low back and whole spine. Then I'm going to move over here. I can rehabilitate a disc that's torqued, tipped, and more dry. Discs that are compressed and don't move change color from yellow to more brown. They become more brittle. When you do this kind of motion, they enhance value and they get nutrients back and they get motion. We then go to the other side, do the same thing. Then turn 45 degrees. When you're 45 degrees, you get this kind of motion. Go to both sides. When you,
Can I do all of those?
yes,
Okay.
and then when you get about done, slide it forward, let the pubis down, make sure your shoulders are up, let it work. When you're all done, just grab on, stand back up. Okay.
Question. When you are sitting down, all of a sudden your legs are not in the picture, your head is closer to the platform. Is it more intense with your head closer or no?
The closer the object is to the therapy, the more value you get. So when you sit, you get more value to your low back than when you stand. When you sit, you get more value to your neck than when you stand, because you're closer to the motion. Now, with this machine, a chair comes with it. So you would take this out, we could set a chair in there, which then raises you up, but it's high. A lot of people don't like to use a chair, but it's very valuable if you need it. That's an option you have. Did that answer that question?
Yes, thank you.
So I have a question. I have one without the handle, you know, with the little red one.
Yeah,
And on the setting one, it feels like my setting one is going quite a bit faster than
It
this
is.
one.
it is.
Okay.
And you do the numbers the same. Okay, now, I'm gonna give you an idea of what I do in the morning. Every morning, I have my routine. I recommend to you that you establish a time, and you do it. Every day. I recommend you do it at least twice, every day. If you only do it 3 minutes, twice, you've done your body a tremendous value in, number one, you're gonna build better stem cells. Number two, you're gonna have better alignment to your body. Number three, when you have better alignment, you have better relaxation. Backtracking, if we had the 206 bones and the 800 ligaments, like a puzzle, we started at the feet. We put the foot together, the ankle together, we went up, we have the whole skeleton standing balanced with only bones and ligaments. That's the goal. The goal is to get totally balanced. Now, I have a picture of that, and I didn't bring it in. Would you bring it for me? It has a normal spine. It's on my table. You're welcome to have one of these. I recommend you have the picture in your mind. You can, if you believe in goal setting, it's a good thing to look at frequently. This is me in the future. We want to get you back neutral and normal. Okay, what do I do in the morning? I have my routine. My T-zone is in the hallway, it's convenient, it's close. I come up to it and I push down 5 times to the program number 5. I turn it on, it starts at 25, and I get on it, and I go through it. I go through many things I told you about today. I turn my head, I combine, I do this, I turn my torso, I bend my knees, just a whole different bunch of combinations. I do that for about 8 or 9 minutes of all different things. I pretend like I'm skiing from my feet and knees and my low back, I lean, I turn sideways, I do my feet. I didn't show that. Do the feet, go up and down, toes out, up and down, toes in, up and down, then I come back up. So my foot is behind center, now I'm bouncing. This is very good for osteoporosis and to stimulate stem cell growth. So I do all that routine. Then I sit down. I always do what I just showed you. I start in the middle, but I add weight. I like to add weight so I can do my arms also at the same time. So I have 10 pounds in each hand. I do wrists, elbows, shoulders, a lot of different motions. I recommend if you're gonna use weights, start out with 1 or 2 pounds. It make a huge, huge difference. Okay?
Legs crossed, oh, they're just down, okay, I didn't know if they were crossed or.
I'll get those pictures for you later. Then, the last thing I like to do is do shoulders and scapula. So turn around, arms straight, lower the chest down, then let the scapula go back together.
So that's a good move for thoracic itching and nerve engagement, things like
Very,
that.
very good for all that. And the shoulders, elbows, do fingers straight, fingers out, fingers in. Intensity is greater if you go out, less intense if you go in. I like to do real push-ups, I like real push-ups. Go up and down. They're much harder to do on here because of the motion. They do a lot more valuable because of the motion.
I like to do lady style push-ups on there.
Pardon?
I like to do lady style push-ups on there.
Most ladies do. Any questions?
So really, any type of movement you do on there helps.
True.
If you do it as best you can, keeping yourself in alignment, it
Yep.
helps.
If you lean a certain way and you're on that, you're trying, I can't remember the word you used, but trying to lean the other direction, would you not do the exercise that you normally lean to and do, like, say for example, my neck? I tend to lean to the right. So would I do my exercises only on the left?
No, that's a perfect question. The quick answer is no. The body will always try to be symmetrical. Same on both sides. Whenever you do any kind of rehab, wherever you're doing, do the same on both sides. For example, when some of you that are doing the cycle slide, I tell you, if one foot goes this far and the other foot goes this far, only mats the one that's limited. So if you turn your head here, you can go way over this side, you can only go to here, match, only go same. Does that make sense?
Mhm.
The idea is to not train one side more than the other. The idea is to train for a balance, train for symmetry.
Okay.
Remember, that's most important. And if you tie this into the class I gave you a few weeks ago on the profile, this also helps your personality to become more neutral, less logical or emotional, less aggressive. Being aggressive is combined with head forward posture. Let me explain it to you briefly. A lot of people who have head forward posture make the claim that I'm not doing that much, but what they're doing in truth is they are doing more than they should do, more than is safe for them to do. And even though they push, they go, they're breaking down. This person right here is breaking down very, very fast. That person will not live a good life very long. They can't. They will run out of energy. There's no way they can eat enough food to provide the energy to carry 50-pound head around that far off center. Okay?